Hi, today we're going to talk about the lower part of rectum and the anal canal. Objectives are gross anatomy, blood supply, nerve supply, lymphatic drainage, development, and applied anatomy, hemorrhoids. Anal canal is present below the level of pelvic diaphragm. It lies in the anal triangle of perineum between right and left ischioanal fossae. Here is the lower end of rectum, and this is pubis with puborectalis. Behind is coccyx. This is anal canal. The length of anal canal is 3.8 to 4 centimeters, and the junction is ano-rectal junction. Anal canal extends from the junction to the anal orifice. Anteriorly we have pubis. This is puborectalis, which is a part of levator ani muscle. Posteriorly we have coccyx. Let's see the coronal section of rectum and anal canal. These are the layers of anal canal. And these are the muscular layers. The dots shows the circular muscle, and outside we have longitudinal muscle. Okay, from inside outwards we have the lining epithelium, then submucosa, inner circular muscle layer, outer longitudinal muscle layer. So what is the lining epithelium? It is simple columnar epithelium, which is derived from endoderm, and this extends up to the upper part of anal canal. Here we have a muscular fold called anorectal ring, and this is formed by the fusion of three structures. What are the three structures? They are internal anal sphincter, deep part of external anal sphincter, puborectalis, part of levator ani. Anal canal has two sphincters, internal anal sphincter and external anal sphincter. Here is the internal anal sphincter, and outside we have external anal sphincter. Here we can see the internal anal sphincter is a continuation of inner circular muscle layer, and this contains smooth muscles, hence it has involuntary action, whereas the external anal sphincter contains skeletal muscles and they are voluntary. External anal sphincter consists of three parts. They are deep, superficial, and subcutaneous part. This is deep, superficial, and subcutaneous part just beneath the skin. There is something called conjoint longitudinal coat. What is meant by conjoint longitudinal coat? This is puborectalis, part of levator ani. It merges with the longitudinal layer of internal sphincter. Puborectalis plus longitudinal layer of internal sphincter. They together form conjoint longitudinal coat. This conjoint muscle and this conjoint longitudinal muscle coat descends between the external and internal anal sphincter, divides into septations, pierces the subcutaneous part of external anal sphincter and attaches to the perineal skin at the level of white line of Hilton. It's a demarcation between middle and lower part of anal canal. Let's move on to the internal appearance of anal canal. This is the upper part, which is 1.5 centimeters, middle part 1.5 centimeters, and the lower part is 1 centimeter. Mucous membrane is lined by simple columnar epithelium like that of lower part of rectum, which is endodermal in origin. It throws longitudinal folds called anal columns. At the lower end, anal columns unites to form anal valves. Just above the anal valves, we have anal sinus. The mucus secreting mucus glands opens into this anal sinuses. The lower part of anal valves, it joins to form a line called pectinate line, which is an important demarcation here. The white line of Hilton separates middle from the lower part. Middle part is lined by squamous non-keratinized epithelium. The submucosa contains deep venous plexus, and because of this, it has a bluish appearance. And the middle part does not contain anal valve or anal sinus or anal glands, unlike the upper part. The lower part is lined by skin, so it contains sweat and sebaceous glands. The middle part also does not have sweat or sebaceous or hair follicles, unlike the lower part. As the lower part is lined by skin, it has stratified squamous keratinized epithelium. So what is the development of anal canal? As I told, this pectinate line is a very important line of demarcation. Structures below the pectinate line develops from proctodium, which has ectodermal origin. Structures above the pectinate line develops from endoderm, from the terminal part of hindgut. And because of this difference in development, the blood supply, nerve supply, lymphatic drainage differs above and below the pectinate line. Moving on to blood supply of anal canal. Above the pectinate line, it is supplied by superior rectal artery. It is continuation of inferior mesenteric artery. Below the pectinate line, anal canal is supplied by inferior rectal artery, branch from internal iliac artery. Similarly, venous drainage. Superior rectal vein drains into inferior mesenteric vein, which drains into the portal vein. Below the pectinate line, venous drainage inferior and middle rectal vein drains into internal iliac veins, which drains into the inferior vena cava. So we can see this is the junction where the two systemic veins meet. And this is the common site of portocaval anastomosis. Moving on to nerve supply. Above the pectinate line, it is supplied by inferior hypogastric plexus. Autonomic nerves takes over the sensory supply. Below the pectinate line is by inferior rectal branch of pudendal nerve. The motor supply is by the motor branches from the inferior hypogastric plexus to the internal anal sphincter, whereas below the pectinate line, motor branch from inferior rectal branch of pudendal nerve to the external anal sphincter. Moving on to lymphatic drainage. Above the pectinate line, lymph drains into superior and middle rectal lymph nodes, whereas below the pectinate line, the lymph drains into superficial inguinal nodes. There is something called rectal venous plexus. This rectal venous plexus is formed by the tributaries from superior, middle and inferior rectal veins. This venous plexus is situated in the submucosal layer of middle part of the anal canal. And what is meant by anal cushions? The rectal venous plexus plus fibroelastic tissue plus smooth muscle together forms a submucosal mass called anal cushions. The usual positions are left lateral, right anterior and right posterior position. In lithotomy position, these anal cushions are present at 3, 11 and 7 o'clock position. The engorged vascular cushions are termed as hemorrhoids, and the usual position of hemorrhoids is as that of the anal cushions, 3, 7 and 11 o'clock position. Now, what are the types of hemorrhoids? It is of two types. Internal and external. Internal usually occurs above the white line of Hilton, external below the white line of Hilton. Internal is usually painless and the external is painful.